no mountain that cannot be moved in his name. Jesus, there is no bound.
Welcome back to Wisdom and Life. Thank you for watching my videos. Thank you for supporting. Thank you for just giving me that motivation to keep on going. Today's Wisdom and Lifeline is about loving people. And the Bible says that it is the only way that people will know that you are Jesus' disciples. So I want to challenge you today to just show love to someone. Today it's not a preaching day, but I will refer you to 1 Corinthians chapter 13, and you will know how to love people. It is by action, it's not by word. Now, to today's topic, I want to challenge you who is watching to take care of your health, or to take charge of your health. There's a slogan in Swahili that says, afya yetu, jukumu letu. We are fond of complaining, oh, government this, oh, government that, oh, hospital this, oh, hospital that, oh, nurse this, nurse that, doctor this, doctor that. And sometimes it's things that we on our own are able to do. For example, when you go to hospital, you just don't need to be told that you have an infection. You need to ask, what infection? You don't just, when someone asks you, when ni mgonjwa wapi, ati walisema niko na infection kwa damu. It's really awkward when I'm asking someone when ni mgonjwa aje anasema wameniambia niko na infection kwa damu. Yes, it's good we try and bring it to the understanding, a lay understanding of a lay person, but it's just good to know, and especially if it's a chronic disease. Don't just be going for medication and coming back and you still don't know what is it that you are treating. Sometimes you may know, for example, I have hypertension, and you are taking medication for hypertension, but the fact that you're still not adhering to the dietary guidelines, you're still not adhering to what you need to do as an individual, it just brings out a lot of ignorance about you, not really knowing what you are, the condition, the kind of condition that you have. I've seen patients, you ask them about their past medical history, and the things they tell you, you're like, oh goodness gracious. So it is you to figure out what is this person telling you. And because it is your body, I may figure out something that is not true. If you only know that you have a chest congestion, will I now be able to tell, is it asthma? Is it a cardiac congestion? Is it another chest problem, a pneumonia or something? And you yourself, you are not aware. Sometimes when you ask a patient, which medication do you take? And then anakwambia, kuna ka tablet kengine hivi kadogo ka pink. And you're like, goodness gracious, we have so many small pink tablets. Which one is this? Get to know the name of the medicine you take. If possible, even when you're going to hospital, go with the empty box of the one that you've just finished. Please don't just assume that it's a pink tablet. We have so many other pink tablets. Maybe the medication you are taking is reacts with another medication that the doctor may prescribe for you, yet they don't know which drug you are taking. They don't know which other. And if you are moving from one hospital to another, be sure of your history. Know properly what, if possible, carry your scans, carry your blood works reports if you have any, carry your previous medication if you have any, so that it's easier even for that other doctor to tell what is it that you have been taking, what is it that is being treated, what is it that you have been treated previously for, and there's continuity even in your care. So take charge of your own health and know what you are being treated for. Ask questions when you go to hospital. Get to know exactly what are the medications that you are using. How do you react to them? Sometimes they may be causing you serious side effects, but because you just think it is medication, you continue taking. Maybe you are vomiting because of that particular medication, but you just take and continue vomiting. Maybe you're having diarrhea because of that particular medication. You just take and continue having that diarrhea. Maybe you are even reacting like you have an allergy, but because the doctor said 1 times 2, you just keep taking, but you even don't know. Sometimes you have even up to 10 medicines. I know people who take such many drugs, but they don't know even any of them. They don't know which one is this, which one is this. Why am I being told to take in the morning and not at lunchtime? Why am I being told to take at night and not during the day? Sometimes even eye drops. You need to ask which one should come first and which one should come last, and why. How, what is the time period in between I should wait before I install another drop? So it is your responsibility to know and take charge of your health. Basically, it has helped me in my journey, not because I am a nurse, that's why I'm talking about it, but I just feel it's good to know. It's good to know about what you're being treated for. If you're telling me that this is my condition, then I should be knowing how do I manage going forward. I have been diagnosed with diabetes. How often should I check my blood sugars? What time should I check the blood sugars? Is it insulin I'm going to be using? If yes, what time should I inject this insulin? How often should I inject this? When should I inject? How? What is the level of the blood sugar before I inject insulin? After eating, what time do I check my blood sugars? These are the questions that really need to be explored at the point of a diagnosis, and this will help you to have adherence. It will also help people to be not to get fatigue even during treatment, because psychologically you are prepared that this is going to take a lifetime. It is not something like malaria. You will get the required doses of L and that is it. If you're being diagnosed with cancer, like for example in my case breast cancer, I am so grateful, and I've mentioned about Dr. Otieno, who is a breast specialist. He took his time to really take me through. Despite the fact that I am a nurse, he did not assume that I know these things. And knowledge plus the concern and care and just giving information as it's supposed to be given will really help even during the treatment journey. And some of us, like myself, I operate on a linear. My mind, my thought process is in a particular direction, in a particular line, so that I'm actually following to the book, everything you tell me to the book, because I know the benefits that are going to come from this. So if there is anything that you miss at the point of the diagnosis, then it's really going to affect my journey going forward, even mentally, even emotionally, even psychologically, so many ways that I'm going to be affected. So during that time, I understood that this my treatment anchor was going to take chemotherapy. Then after chemotherapy, we'll have a period of a break where the chemo has to wear off from the body system. Then after that, now surgery, because the reason was that the tumor was to shrink. Then after surgery, of course, there was a season that healing was to take place of about 8 weeks. Then radiotherapy, I'm going to have 28 sessions plus 2, except for Saturday and Sunday. With that in mind, then psychologically, hakuna hapo mahali hapo katikati tutasumbuana, because my head already knows, and my heart, even psychologically, I'm set. So in my mind, it is very clear how the treatment journey is going to look like. And I'm not saying is as per the book. Sometimes, depending on how the patient is responding, there may be changes here and there. Please let them know that, but this basic knowledge will be very, very useful for them to adhere even to the hospital visits. They need to understand why they need to come to the hospital regularly, or as scheduled, or as often. You have patients who default along the way, and when you sit down with them, you realize that nobody told them that this journey was going to take a lifetime. Especially the first time you get diagnosed with a condition. And this I will challenge doctors and nurses and medics to please take your time to explain to this person that condition. If there is any material that for education you can give them, please do, so that they are able to understand. Is it hypertension? Sawa. So how long am I going to use medication for life? And how does, if I don't take this medication, what is it going to affect? It's going to affect my eyes, it's going to affect my kidneys, it's going to affect several organs in my body. So once they understand that, then adherence becomes very easy. Kitambo, when I was a new nurse, I remember we used to do this program for TB treatment adherence. And the reason as to why we were doing TB treatment adherence is because this treatment was going to take a long time, up to 6 months, sometimes 9 months, depending on the kind of TB and also the response to treatment. So if you don't sit with the patient at the early stage and explain to them why they need to adhere to medication, 1, there's a possibility of a relapse. 2, is also becoming a risk to the public, the rest of the people. And I remember at some point, I don't know if that law is still in force, so that when you're not taking your medication, they will take you to prison. You'll be arrested, so that you are given medication in the cells until you are well and you can come out and now mix with the public. My point here is information is very important, especially the first time someone is diagnosed, and especially when this condition is going to take long, especially when this condition is going to affect their lifestyle. If they need to make some dietary adjustments, let them know at that time of diagnosis. If they're going to make some lifestyle adjustments, let them know at that particular point. Sometimes it may even require them losing weight. Let them know at that time, so that they will know that it's not just exercises for the sake of exercises. It's exercises as part of their treatment journey. So back to you. You need to take care of your own health. There are things the doctor will not be able to do for you. They will only give you instructions as I've indicated, but compliance, adherence to treatment, that is basically your duty. It is you to do, it is you to take the medication at the right time, it is you to know the type of medication or the kind of medication you are taking, it is you to know the side effects if something is going wrong, it is you to know if you are told to check your blood sugar, you should know the normal ranges, when it's going low, when it's going high. It is your responsibility to know. Sometimes, if it includes taking care of your diet, it is you to violate or it is you to adhere to that particular diet. If it is about exercises, if you do not do exercises, the doctor will not be able to do that exercise for you. Because if they did, it will be for themselves, not for you. So take responsibility of your health. Afya yako, jukumu lako. Just stick to the medications as you're supposed to. Take your diet as you're supposed to. Know what kind of condition you're being treated for, and keep to your doctor's appointments. Don't assume that it is too soon or I have a commitment. Just commit to it just the same way you commit to your other things, so that we remain alive and we remain engaged. And if you are a relative and you are watching this video, when you take your patient to the hospital, please also don't be ignorant. You are there as their support system. Some of these things, if they do not pick, because sometimes it affects their mental health, it affects their emotional health. At that particular point, there's one or two things they will miss. But you, as the support system, you'll be able to pick out, the doctor said A, B, C, D. Sometimes when the patient is being defiant of the doctor's instructions, maybe out of stress, or maybe they think they have lost hope and they say, after all, many people have died out of this condition. I'll eat whatever I will eat. I will do whatever I want to do. I will not comply with the doctor's instructions. So as the support person there, kindly watch my video on taking care of a sick person. Your work as a support person, you are supposed to not just tell them what they need to do. Be a bit polite, be a bit understanding, be a bit empathic, and just get to help them walk through the journey in their sickness. So thank you for watching this video. Keep supporting, keep sharing, like, comment, so that one day my vision is to see this channel support at least one cancer patient. That will be my joy. God bless you and thank you so much.
Zangu, 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 zangu ni shukrani Mungu. Zangu, zangu.